Hi, I'm Dr. Hamid. Today we will discuss about an important topic which is most often tested on UCML Strip 1 and other board exams. The topic for today is immune privilege and its clinical significance. First, we will briefly discuss about immune privilege, and at the end we will discuss about its clinical significance, which is very often tested on board exams, especially UCML Strip 1. So, what is immune privilege? It is the condition in which selected immune responses are suppressed or excluded in certain organs, such as the eyes and testes. In simple words, it means that in our body there are certain organs, certain tissues in which the immune responses are either suppressed or these organs or tissues are excluded from the immune responses, which are usually elicited by our immune system. There is actually no exposure of the antigens of these tissues to the immune system. How these tissues or the antigens of these tissues avoid the exposure to the immune system? This is achieved by basic three mechanisms. There are some anatomical barriers which prevent the interaction between the immune system and the tissues antigens, which we call self antigens. There are some physiological processes which alleviate the immune responses against the self antigens of the tissues, or there are some immunoregulatory processes in which the immune responses are suppressed against the tissue's antigens. Now, the self-antigens located in these immune privileged sites usually they escape the negative selection during T cell development in the thymus. Now, we all know that what happened in the negative selection during T cell development. In the negative selection, usually the self-antigens of the body are presented to the T cell in order to check the affinity of the T cells to the self-antigen of the body. Now, if the T cells have strong affinity toward the self antigens, those T cells are eliminated. Why they are eliminated? In order to avoid autoimmune phenomena, in which sometime the T cells which have strong affinity against the self antigens they can attack our normal tissues. So, in order to avoid this, the negative selection is usually carried out in the thymus during T cell development. So now the these immune privileged sites, even they escape this negative selection too. It means that they have no exposure to our immune system at all. Now we will briefly discuss about the three basic mechanisms which are important for the immune privilege. The first is that there are some anatomical barriers which prevent the interaction between the immune system and the body's organs or the self antigens of the tissues. These anatomical barriers are there is one is blood testis barriers, in which the Sertoli cells create a blood testis barrier and divide the seminiferous epithelium into two compartments, basal and luminal. And the purpose of this blood testis barrier is to prevent the developing spermatids from the immune responses. They are not exposed to our immune system. The other one is the blood retina barrier, in which the internal antigens or the internal cells of the eye are prevented from our immune system. The physiological factors which contribute in the immune privilege are that there is decreased expression of MHC1 on the self-antigen cells in the immune privileged tissues. Now, when there is decreased expression of the MHC1, it means that the antigen presentation is also decreased, so the immune system response will be very low. So in this way, these immune privileged tissues again they invade our immune system. The other physiological factor which contribute in immune privilege in certain tissues is the lack of lymphatics, because through lymphatics the T cell and the antigens they usually flow from one tissues to the lymph nodes, where they are present to the T cells, and an immune response is elicited against those antigens. So these organs lack their lymphatics. So in order to prevent immune cells and antigen interaction again, and they invade again the immune system. The third most important factor in immune privilege is the immunologic regulatory processes. There are different processes which regulate the immunologic responses at the site of the tissues in the immune privileged tissues. For example, there is suppression of inflammatory cytokines locally, which alleviate the immune response against tissue or antigens. The another process is the macrophages in the tissues. they have a decreased capability to take the tissue antigens or the tissue self antigens. The third one is the increased anti-inflammatory cytokines. So anti-inflammatory cytokines, they again alleviate the immune response against the tissue antigens. What is the purpose of the immune privilege? The main purpose of immune privilege is to prevent damage to the certain organs uh, which have no or limited capacity to regenerate. It also decreases a collateral damage during an active inflammatory process. It means that if there is any inflammation in the tissues, the immune privilege usually decrease damage to the normal tissues. What are the examples of immune privilege? The two best examples in our body of the immune privileges are the eye and the testes. In the eye, there is blood-retinal barrier which prevents the free entry and exit of the cell. So when there is no entry and exit of the cells from the eye, there will be no interaction between the and tissue antigens and the immune systems. The another one theory about immune privilege of the eye is that the eye lacks efferent lymphatics. So when there is no efferent lymphatics, there is no exposure of the antigens to the lymphatics. The other most important organs which have the property of immune privilege is the testes. And again, here there is blood testis barrier which prevent exposure of gametes to the immune system. There is decreased capability of macrophages, and there is suppressed antigen presentation by dendritic cells. Now, coming to the clinical significance, the most important clinical significance which is most often tested on is similar step one is a sympathetic ophthalmia. What is sympathetic ophthalmia? It is the inflammation of the contralateral or the normal eye after injury or trauma to one eye. It means that when there is injury or trauma to or one eye, it results in an inflammatory response which also affect our normal eye. Because previously we studied that eye is an immune privileged organ, mean that its antigens are never been exposed to our immune system. So when trauma occurs, it results in the release of self antigens into lymphatics which previously were immune privileged, but now they will be recognized by immune system as a foreign antigens. So an inflammatory response will occur, and this inflammatory response will affect the normal eye as well, because the antigens of the normal eye and the other eye are the same. So this is sympathetic ophthalmia, means that if you have got a patient who has an eye injury, and if the eye injury is left untreated, after a few months, days, even years, the patient can be presented with the complaint of the eye pain and the vision loss in the normal eye too. Why this occurs? Because the inflammatory response in the one eye is also affecting the other eyes because of the mimicry of the antigens. So take care of the patient who have got eye injuries, so they need to avoid damage to the normal eyes too. That was all about immune privilege. The topic is very important and very frequently tested on board exam. Thanks.